right, so we have 1 o'clock. As promised, let's get ourselves started. Good afternoon. I'd like to welcome everyone from coast to coast to coast here in Canada to the Canadian MPN Network, Patient Advocacy and Education, Patient Conference Day number 2. Normally we would have our conference in person, but with the situation and the times that we're living in, we're actually able to get our message and have our conference held virtually and be able to have many more people attend our conference. So I welcome you no matter where you are in Canada or perhaps around the world joining us today. So from coast to coast to coast, thank you for joining us. It's wonderful that if your weather is inclement where you are living, that you can cozy up in front of your computer, in front of your TV screen, however you're enjoying us, with a cup of coffee, tea, or beverage, and a light snack perhaps, and sit back and enjoy our guest speakers today and all that we can provide to you to support your journey having an MPN blood cancer. My name is Cheryl Petrick. I'm the Executive Director of the Canadian MPN Network and the Canadian MPN Research Foundation, and I'd like to welcome you once again. So thank you very much for taking time out of your schedule on Saturday afternoon to attend this afternoon with us. So some housekeeping that we'll get through right now is that everyone is put in mute mode, and that's just so that we don't have any background noises for our speakers, and hopefully you can hear us, and we've put you in mute mode so that you can hear our speakers clearly and to the best possible availability from your system that you're watching on. We will have questions asked by yourselves. If you do have a question, please type it in the chat and we will get those questions forwarded to Dr. Rutledge, and we will ask him those questions on your behalf. And certainly if we don't get a chance to get to your question, please know that we will be taking down all of the questions and we will get Dr. Rob to answer those questions. So you can do that in a couple of ways. Put it in the chat and we will take note of your question in the chat, or you can send us an email. And our email is on our website and you can send it to us, and then we will get back to you either by posting all of the questions and answers in their entirety on our website, or get back to you individually with an answer to your question. So please certainly do ask questions. We look forward to the questions, and I know Dr. Rutledge will be very happy to answer as many questions as we can during his time. So with that, those are our announcements. I will just forward to our agenda. And today's agenda is that we will have Dr. Rutledge speak. We will have a intermission, stretch and refresh at 2:05. We'll return at 2:20, at which time we'll have the Canadian MPN Champion Award presentations. At 2:40, we'll have the Advocacy Committee presentation. And then at 2:50, wrapping up the afternoon, we'll have announcements and thanks to our sponsors and our conference committee. So once again, sit back, relax, and enjoy the afternoon. And thank you for taking time out of your day to attend this session with us. So now it is my indeed pleasure and honor to introduce Dr. Rob Rutledge. He is a radiation oncologist and professor in the Faculty of Medicine at Dalhousie University. Rob co-created Skills for Healing Cancer Weekend Retreats to teach a powerful and integrated approach to healing at levels of body, mind, and spirit. He is an author of the book, The Healing Circles, capturing teachings and inspirational stories from these weekend retreats. In recognition of his contribution to health promotion to cancer patients, Dr. Rutledge has received both a Cancer Care Nova Scotia Award for Excellence in Patient Care and a Health Promotion Award. So his presentation today will be dealing with the emotional stresses of living with a chronic cancer in the times of COVID. So thank you very much again, Dr. Rutledge, for joining us. And I turn it over to you to take it away.
Thank you, Cheryl. And thanks everybody for attending. You're really making a difference in your lives by learning some practical ways that you can feel better, to promote your health, promote your happiness. So I'm excited. I'm just going to change that to speaker mode. And maybe I'll just flash some slides right at the start here. So I'm assuming you can see my screen there. Yeah. So, This is a challenging time. You know, having a chronic cancer is also a challenging time, but I am also very hopeful for you. And you can think about your long-term goals, like what is it that you actually want to accomplish? What is it that you would like to get from this presentation, for instance? And so here are a couple that you might be thinking about. You want to maximize your chance of longevity, right? So by empowering yourself, by promoting the mind, body, spirit connection, you can actually have an influence on your physical health. I also believe that, you know, there's billions of dollars of money that's going into research. It's possible that we can actually convert some of these chronic cancers into actually cured cancer, so that we can be hopeful around that side. So how is it that you can maximize your chance of longevity? So physical health. You might be thinking about, and this is kind of the title of the presentation, right? How to feel better emotionally. You know, during COVID, you know, the worry about getting COVID, the worry about delays in medical care, you know, just the whole anxiety that we Canadians are going through right now. So there are practical, real ways that you can actually have an influence on your emotional health, which will profoundly influence your physical health and other aspects of health. Other things you might strive for, right? How is it that you can think more clearly, get your brain to function better, right? And so that you're enjoying the things that you love in your life more, enjoying your relationships, enjoying your family, enjoying your activities, right? Again, there's this empowerment piece that I'm going to talk about that will be helpful in those realms. Our relationships are ultimately really probably the most important thing in our lives. And so, how can we connect more deeply? And lastly, you might see, you know, your life process, your life journey, your healing journey is being able to grow psychologically and spiritually. And what I want to suggest to you is that as you healed at any one of these levels, it profoundly influenced the healing at the other levels, right? And so we're talking about the emotional healing, dealing with stress, frustration, you know, feeling alone or depression. So how do we feel better emotionally? And the emotional health will result in better physical health. So I'm hoping you're going to take away something that's very concrete here. What do I want you to take away? So at the end of this presentation, I want you to know that you really can profoundly influence your health and your emotional levels and your immune function. We think about COVID and no chance of getting a virus. If your immune function is better, you have less chance. I want to say as well that, you know, why is it that we are doing these things? Well, because we want to enjoy our lives more. And when we are our best selves, when we're happier, you know, more content, at peace, more grateful, whatever it is that you value, when you're your best self, you can actually choose that, right? So there's this kind of empowerment piece around the kind of attitude around that. And lastly, just to recognize that you have a huge amount of kind of inner wisdom and resilience, way more than you would expect. And even if you kind of visualize a difficult situation in the future, there's something within you that can match that situation. So I want you to understand that. In the meantime, let's work at the things that can really kind of make a difference in your health. So this is what I want to talk about. I want to put this within the context of how to get the best cancer care. Right? So what is it, the practical aspects of this? How does the healing at the level of the emotions fit into that? I want to talk about your choice, setting your intention for whatever is best for you. And then we're going to talk about practical ways that you can actually change how your brain works so that you're the happier, more positive version of yourself. So less of the difficult emotions, more of the positive emotions. So ultimately you'll be happier. I want to take us through, well, what do you do when, you know, suddenly flustered, angered, overwhelmed? So some practical ways to kind of settle yourself down in that moment. And then we're going to talk about the fact that oftentimes our thinking or concepts or perceptions are actually causing a lot of the difficult emotions. So by reframing the difficult thoughts, we can ultimately be more functional and happier. So we're going to go through, I want you to walk away today with some real practical ideas as to what can really help you feel better and be stronger. Okay, so first of all, which is the context. The context is the empowerment piece. And it starts with understanding your situation. And hats off to each and every one of you, you know, joining the MPN networks, you know, weekend and, you know, tapping into the resources empowering yourself with information. Information can happen at the medical level, at the kind of complementary level, et cetera, et cetera. So super important, and really, really, it sends a huge meta message for you just to be listening to this video right now. So secondly, there's a whole piece around how to advocate for yourself, how to get the best care from the medical system, recognizing you're the most important person here, right? That the medical system's there to serve you. And that's probably about a half an hour talk by itself. So I'm not touching on that side as much as the empowerment piece. Those healthy lifestyle choices actually have a huge influence on your physicality, your immune function, how your brain works, how the emotions, are translated within your brain. And so we're going to focus on a little bit more on that side. We're going to talk about the healing skills, right? So the practical things, the work you can do to actually help yourself feel better, be stronger, really tapping into the kind of scientific proven mind-body connection. And ultimately, you can look at it from a bigger perspective, right? Being able to hold your life with a sense of kindness and peace and a bigger perspective, this kind of spiritual view. So that's how I envision complete cancer care. And we're going to kind of focus now on a kind of narrower range within that kind of bigger puzzle or bigger pie. I want to first of all point you towards there's some really actually kind of cool science coming out these days around what they call positive psychology. Now, this is a book written by a couple of corporate trainers, Foster and Hicks. They decided that they wanted to find out how different people around the world experienced happiness. And they had this idea that it would be culture specific. And so they went to, I think it was something like 60 countries. It was a kind of a fun project because they would go into a village at some distant country, and they would go up to the first person. They'd say, please point us to, a really positive, wonderful, happy person. We want to go interview them. And inevitably they would get, guided towards, Uncle Josefi or Auntie Maria, knock on the door and get invited in for tea. And then they would interview these amazing, lovely people. And just to let you know, they did not necessarily all have like easy, perfect lives. A lot of them had gone through a lot of real difficulty, really, really trying times. And yet they were these positive, wise, wonderful people. And what Foster and Hicks realized was that it was actually universal. There was no kind of culture specific. It was no matter what the culture, these people had these kind of characteristics. And so I'm telling you partly because it's about setting your intention, which is what we're about to do. But these people decided consciously, I'm going to enjoy my life. I'm going to experience happiness. So they kind of set a commitment to being happy. The second one was they assumed responsibility for their lives. Instead of kind of pointing the finger out at other people or even life itself, they said, well, I'm going to be responsible for how I feel in the circumstance. They identified what makes them happy. And so this is what I would call authenticity, listening to your inner heart as to what is right for you and not necessarily choosing what society chooses or your friends or your family or your background. So they make it central to their lives, right? The same idea. This is also, I'm trying to point you to this idea that there are certain attributes of remarkable cancer survivors. The people who do exceptionally well after their diagnosis, who far outlive their doctor's expectations, who undergo spontaneous remission, those type of people. And I've been studying that throughout my career now. And it's there's a huge overlap between the remarkable cancer survivors and what I'm describing here in your slide, including the recasting part of this, right? So I'm going through a difficult time. There's a challenge here, but I'm going to find meaning and purpose and express my joy and love in this situation, despite the difficulty. So there's this, seeing the cancer diagnosis as an opportunity to reprioritize or to recast is what they've done as well. So again, typical of the remarkable cancer survivors. I like this one as well because I'm trained as a typical Western scientist, within the Western medical system, but I recognize that the Western medicine does not have it all. There's more to this than meets the eye, including a sense of energy, a sense of spirit that has an influence on our health. And so even doing something as simple as a kind of standing exercise like Qigong, I recognize that there's something else happening there that I can actually tap into that helps my personal health. So staying open to possibility and change and so on. Very interesting, a sense of gratitude, right? So even in the midst of difficulty, what do you focus on? Do you focus on, the shattering, the loss, the grief of what your life was, or do you focus on what you do have now and to appreciate those smaller things and the wonderful people and even the experiences that you can have? So this is the idea of the setting the intention around it, sense of gratitude. Change the game so that you can win, right? So the game's rule can be that I still have the opportunity to love and to connect and support those people in my lives. This sense of giving without expecting anything in return. And I also really like this one, the sense of truthfulness. I also call this authenticity, or kind of sense of honesty. We release dopamine in our brains when we're honest with ourselves, honest with others. So these are the attributes for the remarkable cancer survivors and happy people, evidently. So that was just a big warm up to say that we're actually going to do a little technique together right now to what they call setting your intention. And you don't have to participate if you don't want to, or participate in a way that feels right for you. But the idea is that we'll just do like a minute or so of a kind of a mindfulness piece. We'll focus on our breathing. You'll actually go through a relaxation response, and then we'll set an intention for, your day or this workshop, or however you want to look at it. So firstly, if it feels right for you, get yourself into a comfortable position, sitting maybe on the edge of your chair. And I like to take a nice strong stance. It's like I'm noble, I'm strong, I'm taking my seat, I'm taking this space. And so the feeling like the head is drawn towards the sky, the spine is relatively straight, hands on your knees, you can eyes looking down or eyes closed. And the first thing that we do is you simply bring our attention into the physicality of our body. So bring your attention to the feelings of your feet connected with the floor. So the sense of connection with the earth, the groundedness. And bring your attention to the weight of the hands on the knees, and maybe even a sense of energy around your hands. Bring your attention to the weight of the body in the chair. So a sense the sitting bones on the chair, sense of groundedness. Bring your attention to your backbone. Again, that sense of solidity. When you bring your attention, your consciousness into your body, you enliven your body, you energize your body. So it's a very loving act to bring your attention to the physicality of your spine. Now bring your attention to the front of the chest. And again, what do you see? What do you feel there? Maybe a sense of openness or warmth, maybe a rawness. And that's our humanity. We have a strong spine and we have an open, warm heart. Now we'll move into the visualization piece. Imagine that you could warm your heart with a feeling of caring and compassion. So allow yourself to feel the positive emotions. And oftentimes it's easiest to do that when you think of somebody that you love, or your pet, or at a different time in your life when you were really connected with somebody. So allow your mind to go into that space of real love and allow your heart to warm as you think of that person. Maybe your kids when they were young, maybe a cherished grandmother. Allow your heart to warm. Now think of somebody in your life who's suffering in some way or form. So it could be somebody close to you, it could be somebody you know at a distance. And again, as you see them in your mind's eye, allow your heart to expand again and send that sense of warmth and love and wish for their healing. May they find healing in whatever way is best for them, and allow your heart to expand, sending them your love, sending you your best wishes. Very nice. Now bring your attention to your other friends and family, cherished colleagues, anybody that you really feel connected with. And again, as you think of those people, allow your heart to warm again. You're like a radiant being of warmth, healing energy, and you're sending that loving energy to each of those wonderful people that you know. Just send your love to them. And extend that sense of compassion and caring to everybody who's listening in now or who's watching this video. Everybody within MPN network. And extend that again to everybody everywhere. Anybody who's suffering MPN or any type of cancer, just in general, just allow yourself to expand. Sense of caring and compassion. Now recognize as you're doing that, you're actually, that warm healing energy is permeating through your body. It's almost a secondary effect. You can actually direct that healing, warm energy towards yourself, maybe towards a physical issue, or an emotional issue, psychological issue. May I find healing in whatever way is best for me. And just send that loving sense of caring towards yourself. And then set an intention for yourself. May I be my best self. May I bring the best of myself into this world. May I manifest my spirit in whatever way is best in my situation. Real sense of choosing your best self. Very nice. So that's the intention, and come back home to simply a meditative state where you're connecting with your body again, sense of connecting with the floor, the weight in the chair, your strong spine. And then open your mind to a sense of possibility and healing and transformation. And recognize that your good human heart connects the two together. Sense of connection with the earth, sense of openness, possibility, and healing. And I'll just chime to finish off. Great. Thank you. So I think setting an intention is just so important for me because it's choosing. The outer world is going to provide you with the same challenges, but you can be in a better state if you choose how you want to respond to them. And so I set my intention in a few ways. One is first thing in the morning, I'll do 10, 15 minutes of meditation. So it's mindfulness meditation. I'll talk about this a little bit later on. My mind is yakking a bit. I bring my attention back to my breath. My mind is yakking a bit. I bring my attention back to my breath. So I'm practicing that muscle of attention. There's a lot of real positive benefits to practicing a relaxation technique. But I tell you this because at the end of that session, I kind of put my hands upwards, and sometimes it comes out with religious language, but it's secular at that point. It's like, please help me. Please let me be the best person possible. Let me be kind and helpful and loving. And so I'm really kind of saying that prayer for myself, hoping that that will kind of manifest through my life as I walk through the day. So, and then I do a few prostrations, kind of submitting to something that's bigger than myself. So that's the first one is, choosing a ritual that brings you back home to what's most important. The second one is, if you know you're going into a difficult situation, for instance, going into a medical appointment, or maybe there's a difficult conversation you need to have with a family member, that's also a time when you can decide how you want to be. How do you want to act in that situation? Going into a medical situation, you want to say, well, I need to advocate for myself. I need to be clear thinking, confident, so I can listen and learn. So it's kind of getting the right attitude going into the, recognizing you're the most important person in the room there. So it's like getting the right attitude in that circumstance. And then the third time I set an intention is when I'm in the midst of the fray. right? When you're suddenly stressed, flustered, overwhelmed, like you've kind of lost it, you're kind of freaked out. That's the point where you try to come back home to your best self again. I've lost it. Lets me remember what's most important. How do I want to be in this world? And so you're coming back in that circumstance. So those are 3 circumstances where you kind of set yourself up to be your best self. Okay. So how is it that we work with this though? And let me just get myself going here. Next thing I'm going to show you is what they call the hand model of the brain. And I think it's important because if you understand how your brain works, then you'll understand how it is that you can actually influence your emotions. So you're seeing this kind of picture, but I might as well just show it to you visually here. So imagine through evolution that the wrist is kind of the spinal cord, and then the base of the thumb is the reptilian brain, the kind of fight or flight part of your brain. So when you're really scared, the car is coming over the curb to hit you when you're walking down the sidewalk, it's that part there that gets you to jump out of the way. So the reptilian brain was the next part of the evolutionary process. It's the withdraw part of this. The next part is represented by the more tip of the thumb, and that's the limbic system. It's the reward-seeking system. It's the approach system as well. And so it's an important part of it. But I would also call that, in a kind of simplified way, I call it the stressed and irritable brain. Is kind of trying to get something all the time. It's kind of always irritated somehow. And next through evolution is the tips of the fingers, which is the very human part of the brain, the neocortex. And that's the wise and compassionate part of your brain. And you want to live out of that part because that accesses you to intelligence, creativity, compassion, attention. It's like whenever you're in a positive state of mind, that's the part of the brain that's really firing. And what happens all day long is we go from stressed and irritable to back to being wise and compassionate. We kind of flip back and forth throughout the day. And for the most of this talk, what I'm trying to get you to understand is that you can influence and kind of come back home to your wise, compassionate brain, because that's the healthier part of it. Your immune function works better when you're there. It allows the rest and digest. It's the healthy part of the mind-body connection. So how is it that we can get this part of the brain to be online and less of the flustered, stressed, depressed self? So that's the teaching for the rest of this. So this is like machinery. You kind of think of it as, how would you get your car to work better, right? So most people will say, well, I'll make sure it has gas in it. It's got oil, windshield wiper. If there's a problem with it, go get it fixed, et cetera, et cetera. So the same idea. Think of this as a physical being, your brain, and say to yourself, how can I get that going? So you're either stressed or irritable, or you're wise, compassionate, red or green. And then we can actually choose, but we choose through our healthy habits to start out with. So the first thing I say is set up the conditions in which your brain is actually likely to function better, right? So if we were here and live, I would say, what is it that you could do to actually get your brain to work better? Or the opposite, how can you make your brain not work very well? Well, if you're taking drugs and alcohol, your brain's not going to work very well, right? But there are actually positive things you can do to actually get that machinery, the neurocircuitry between my fingers to actually fire better and for you to be more likely in this. So we create the conditions, and this includes better immune function. So what's the probably number one health habit that you guys can do to get your brain to function better, to have more energy, et cetera, et cetera? It's actually to exercise. Believe it or not, when you exercise, you release brain-derived growth factors. So you're sending this you exercise and it sends some chemicals to your brain that allows your brain to remember and to work better, right? And we're talking about 30 minutes a day, 6 days a week, getting yourself up to kind of slightly shorter breath type thing. It gives you more energy. Number one, it gives you more energy, allows you to think more clearly, allows you to sleep better, improves quality of life. I really could rant for a long time just around exercise. When you exercise, you're also, you're channeling all that kind of frustration, anger, stress into something that releases that within your body and actually gets you better. And from a kind of spiritual perspective, you're sending a message to the universe that says, I want to get better. I want to get stronger. I want to recover. I want to have the best life possible. So you're kind of tricking yourself from an evolutionary perspective as well to say, I'm important to my tribe. So exercise. Well, how do you do that? COVID, yes, you want to get outside as much as possible. It's not always easy to do. But you can watch a YouTube video, put on your favorite dance tune from your youth, for instance, even like 3 minutes, 5 minutes at a time, slowly moving your body. In fact, why don't we actually stand up right now just for a second, just because it's good to kind of stretch. Qigong can be an exercise as well, right? So just stretch your body for a second, just because we spend too much time sitting. Sedentary lifestyle, the number of hours that you sit is also kind of a risk factor. So try to get yourself up, standing, laptop, and so on. Okay, so I could rant for a long time in terms of exercise, actually empowering your brain and making you feel better. It's the left prefrontal lobe. It's associated with positive emotions. Obviously, diet, right? So if you eat a lousy diet, your brain doesn't work as well. And there's a lot of good science now around the kind of anti-inflammatory diet, essentially plant-based. Stay away from the red meats, for instance. Something called low glycemic, meaning your blood sugars don't spike and then fall down. Because if you have those sugary pops and the cookies and all the kind of processed stuff, it gets the sugar gets into your blood system too quickly, and then your body compensates by bottoming out. And then you flip into the hangry state. The stressed, irritable brain is looking for some calories because it's trying to spare the high octane parts of your brain and so on. And so you can also just feed your brain. So low glycemic means having some protein with your meals and so on. I believe in napping, but I was going to say that there's, when you're tired, your brain doesn't work as well, right? And then, there's the stressed, irritable brain. The stressed, irritable brain is not the happy you again, right? So when we're too tired, and yes, we can't force ourselves to sleep, but we can set up the conditions in which we're more likely to sleep. So, again, there's a whole sleep science, and you can empower yourself with this by, staying away from the stimulants, staying away from the screen time, having a routine, practicing relaxation in the middle of the night if you wake up, staying in the dark as much as possible. And I do believe in napping, 15 minutes before 5 p.m. and so on. Practicing relaxation or meditation. So when you practice that, and we just did a little technique together, when you practice that, you actually innervate the left prefrontal lobe and see how the fingers kind of overlap the irritable brain. So when you're here, it sends signals down into the stressed, irritable brain saying, it's okay, little buddy. Like it's dampening the emotional response. You get better attention. So you're living your life because life is happening only in the moment. So, and I have a slide there around resetting your stressometer. You can go around in your life like this, feeling stressed and upset all the time, flustered, or you can actually reset your stressometer down to a lower, more positive and healthy level. The world will offer you the same challenges, but from this space, you make better decisions and you're happier, right? So why not come back home to that sense of relaxation, sense of peace, because you can actually practice that. Something called neuroplasticity, meaning whatever you practice, your brain gets better and stronger at with time. Touch, simple touch. Now, if you can't hug somebody or pet your dog, which is all great stuff, for your cat, you can actually kind of rub your face, your cheeks, your neck, releases oxytocin, which is anti-inflammatory, is healing by itself. Like we're so wired as human beings, right? Do the things that nourish your soul. Yes, it's harder to do during COVID, but do the things, you want to connect with the most important people in your lives. I say get out into nature, be another important part of this. So you're setting up the conditions in which the brain is more likely to be resilient against the arrows and slings of the world, and B, just more likely to be positive overall. So by nurturing, by doing the things that you love to do. Okay, so the other one is, let's stay away from the stuff, especially the unnecessary stuff that causes us angst and frustration. And for instance, for myself, I can't watch television news without kind of taking it on personally. It's like I see those images and it's just too hard on my kind of psyche and brain. So I don't watch television news. I listen to CBC radio because I want to know what's happening in the world, but without the kind of images. But yeah, so then you can just think about how you spend your precious life. Do you really want to, be involved in activities that don't nurture your soul? Or too much social media? The other one's like, that scrolling stuff is not good for your brain. You get a little shot of adrenaline every time you're kind of look at a post and so on. If you're using social media to connect quite directly with message somebody, then that can actually be very positive. Obviously, stay away from the stimulants. Okay, so the next thing I want to teach you is what happens when anxiety flares. So the point is that we're all human, that there are going to be situations in which we get stressed, right? So we're suddenly going to feel stressed, and super important to be able to recognize it, and then also have a technique or a plan that you can do in that circumstance. And we could take some time to recognize your own individual stress reaction, but we're just actually going to talk about this. When you see yourself wound up too much, how do you settle yourself down? And the mindfulness piece is to be able to watch yourself, bring the observer consciousness into this reaction. So the space or the wholeness holds your life. So spiritual perspective, watch yourself, learn from yourself. The earlier you pick it up, the earlier it is to settle it down. If you can't talk yourself through this, which is almost very, very difficult through just to kind of logically say, this is not worth worrying about. You can practice a breathing technique that we'll go through in just a moment. Or imagine this. You can actually just do this now with me. Just pretend slump back in your chair, kind of look like almost eyes closed looking down, and even pretend that you might be like chewing some gum. When you do that, you can sit up now again if you want. When you do that, you're actually sending what I call a body-mind connection, right? You're sending a message from your body saying, I'm relaxed. Because if you were actually in a stressful situation, your body would not be like that, right? So this is a body-up scenario. You can soothe yourself through touch again. If you have a presentation to do, you can remember, how will I feel tonight? Like after the presentation can often make you feel better. Okay, so I would also say it's important to be able to share what you're going through with even just one person in your life. You can even preface that conversation by saying to them something like, I just want you to listen to me. I don't want any advice or corrections. It's therapeutic for me just to talk about it. I'd really appreciate you just having a good listen. So again, what to do when anxiety flares, when you're suddenly very stressed, angry, upset, overwhelmed, you've lost it. Okay, so I'm going to have you actually stand up as I explain this. The first thing to do is to press the pause button, meaning almost always you don't have to respond right away. Next thing that happens, you press the pause button, so you're letting go of the chattering mind that's causing the stress reaction. Now be very curious about the physical sensations in your body. And so I actually ask you to do that right now. What does it feel like to be in your body right now? As soon as you do that, you're flipping yourself up into the frontal lobe. You can put your hand on your lower abdomen. And I want you to do 4 slow, smooth breaths, especially on the out breath. So maybe breathing in for a count of 3 and breathing out for a count of 6. Nice, slow, smooth out breath. And bring your mindfulness into that activity. Nice and slow. Okay. What you've done now is you can sit down if you like. You've sent a signal up to your brain to say that you're safe. And then you can actually kind of reattach to your frontal lobe again. Your frontal lobe starts to work and you can talk to yourself. Something like, I've been through difficult times before. I can get through this. Let's take one step at a time, right? So you're tapping into your natural resilience once you've kind of settled yourself down. Now, you're not going to get back to perfect. You're not going to get back to like totally relaxed, but at least you're going to be able to function at a higher level and not let the kind of irritable brain do all the talking and all the acting. So we practice relaxation to reset the stressometer, which I mentioned before. The third level of stress is this idea of how we look at our own anxiety, right? So when you're suddenly feeling stressed, do you say to yourself, this is toxic, this is bad, I really need to reduce the stress, I really need to manage this? Or you might say something like, this is too much, I'm not doing this right, I'm inadequate. So it's like, stress is bad and I'm not doing it right. So that's one way to work with it, which is not the healthier way because you're just putting stress on top of stress. The second way is to accept that anxiety is a normal, natural part of our humanness. And if we can accept the anxiety and use the energy of the anxiety, that can actually be helpful. So simply changing your mind to say stress can be enhancing changes how your brain functions during a stress reaction. And then you could talk to yourself and say something like, my anxiety means that something important is at stake. Here's an opportunity to learn, right? So for instance, right? So this stress is helpful, changes your brain instead of trying to fight against the reality of the situation. Okay, so then I'm going to finish off with this idea that it's often our thoughts that are causing us to feel stressed. And if we can reframe our thoughts, then we can actually feel a lot better. So this is, again, and this is almost like a smorgasbord of ideas for you to kind of explore. So an example is a lot of people who are depressed start off with the thought, I'm no good, right? I'm inadequate, I'm a loser, whatever, however they say that to themselves. When they think and believe that, that leads to more depression, right? So the thought is causing the emotion. Whereas if you can reframe that thought to say, each person, including myself, has inherent beauty and strength, then that can make you feel better than what you would have felt otherwise, right? And so the thought can be reframed using, no, it's not like just positive, masking the situation. It's like using your intelligence there. So the teaching is that you can change the way you think and look at things, which changes, you can change your underlying beliefs, right? Because we're creating this kind of virtual reality in some sense. And then, so you can change your perceptions, and ultimately this will change how you feel, right? In your outlook, in your productivity, and how you interact. I mean, how do you bring your best self into the world, I guess is the question. And it's partly through your thinking. Okay, so David Byrne taught this 3-column technique. You can see up top is the situation, which is just the raw reality. And in step 1, this requires mindfulness to be able to watch yourself thinking, how you label the situation. And if you believe that everything you think is 100% true 100% of the time, then you won't be able to get this exercise. You have to have some humility to say that sometimes we start to exaggerate a little bit more, or we are more irrational, or kind of a more immature thinking, especially when we're stressed. So you have to be able to recognize when you're exaggerating. If you're able to recognize the distressing or the automatic thought, especially if it's repetitive, then you can work with the 2nd column, and we'll actually take you through the examples. But essentially that's the kind of logical or parental part of your brain that's able to kind of question what's happening there. And then ultimately you work through the 3rd column on the right side with a sense of acknowledgement and kindness, can look at the situation from a bigger perspective, and ultimately you can encourage yourself. Okay, so that's when your wise and compassionate brain is really working well. You can reframe the kind of the 3rd column. Okay, so let's take a situation. So you're on therapy for your chronic blood cancer, and you're in the midst of COVID, and you happen to have a day when you're feeling tired and emotionally raw. So there's no judgment there. This is what's happening right now. On top of that, then you label the situation, and it's this extra suffering that I'm trying to work with, because there's being tired and raw has an inherent difficulty, right? But we're trying to get rid of the extra unnecessary difficulty. So the first thing is to be able to recognize when you label the situation as an exaggeration. And so you might think to yourself something like, I'm all alone in this. I don't have the strength to get through it. It's no use. And so you're starting to talk to yourself that way. And if you can recognize that, then you can actually work through the unnecessary stuff. So then middle column, so what emotions follow that way of thinking? If you talk to yourself, I don't have the strength to get through this, I'm all alone, you would feel kind of more depressed, kind of sense of despair. That actually decreases the energy in your body. So you're kind of depressive feeling, your body loses its vital energy. I'm suggesting it's not helpful to think this way. How is it exaggerated? So the fourth question is, how is it that you're exaggerating? So when you say I'm all alone, is that true? There's nobody in the whole world that you can talk to? I don't have the strength to get through this. Well, I would also argue that you are getting through this. It's no use. So there's no benefit whatsoever to what you're doing. Like the medication or whatever the drugs you're taking, it's not kind of holding things in check, hopefully. So obviously there's an exaggeration. So then you go to the third column. When you feel that way, you talk to yourself as if you're your own best friend. How would your best friend talk to you if you said that? I'm all alone. I can't do this. This is too much for me. You know, what would you say to that person who's suffering? First of all, I'd say, you're not going to like smarten up, snap out of this. No, you're going to say, yeah, I can hear this. I hear this is a difficult time for you. So you acknowledge this with a sense of kindness, with a sense of compassion. You try to take them to a bigger perspective. I mean, something like, you've been through lots of difficult things before. I've seen it. I've seen this from it. I think you can do it, right? Which is the last part, which is the can part. Now we came up with a slightly different reframe, not to say this is better or worse. Someone could think to themselves, who says you always have to feel strong and keep it all together, right? Sometimes to fall apart, have a cry is the best thing to do. Then it seems, I find, an inner strength or higher power, right? So it's just like, you're trying to live all your life in the next 3 minutes, like all the possible side effects, all the possible iterations of what might happen in the future, putting all this stress on yourself. But when instead you can just relax into your life as it is just right now. Your resilience matches this moment just right now. And that gives you strength. Or you get practical, like, I'm tired today, but I'll probably feel better tomorrow, right? All right. So how about this situation? You have a cancer diagnosis, what you do, and you're staying away from everybody, essentially. You're self-isolating, right? So that's the situation. You made a decision, or even a good decision around that. So that's what's happening. And then you put a label or some thinking on top of that. This is BS. I'm stuck inside and can't do anything. My life is wasting away during COVID. This is totally unfair, right? So you can hear that kind of, there's the stressed, irritable brain going, this is totally unfair, right? If you're able to hear that within yourself, then you can actually start to work with it, kind of acknowledge, yeah, I'm having a tough day. I'm thinking these thoughts right now. So once you acknowledge that those thoughts aren't necessarily reflecting exactly reality, then you can actually start to work with this, change this. Okay, so if you can hear that, what emotions follow this way of thinking? This is bullshit. So this is anger, frustration, which leads to number 2, which is a stress reaction. It's not helpful to get yourself all stressed up. It doesn't help your immune system, for instance. And then lastly, you start to question your thinking. So this is bullshit. I mean, is that 100% BS all the time? I can't do anything. There's absolutely nothing that you can do to kind of help yourself. My life is wasting away. This is totally unfair. I mean, you can say this is difficult, but all these exaggerations are adding to it. So lastly, acknowledging the difficulty. Yeah, it is tough to be self-isolating. It's hard on the psyche. I understand that. But this sense of kindness, see how my voice changes to the kind of kinder, caring voice? Well, I can look at this in a different way. What can I do? And being encouraging of oneself. So, yeah, this is frustrating. It doesn't help to focus on the limitations or and it doesn't help to focus on the limitations. I can do things which fulfill me. This is a chance to focus on good things in love, right? So you focus, you empower yourself on the good side. Oh, yes, this is too much. All the stress is depleting my immune system. I'm going to get the virus and they won't treat me because I have cancer, right? So it's the same idea of causing yourself a stress reaction, not necessarily based on the truth, acknowledging, yes, you're feeling stressed, looking at it, being encouraging. So just in the right calming, it makes sense that I would feel stressed, but it doesn't help to catastrophize. I can take care of myself and empower my body. I can make the best of the situation, right? So this is, in fact, this is the summary of the whole talk, is that you actually can make a difference, even in the midst of a stressful situation or a pandemic, et cetera, et cetera. You have the power through the healthy habits, through all the rest, to actually make a difference. I'll just say you can order our book, The Healing Circle, on our website, healingandcancer.org. It's the teachings from a weekend retreat and the amazing stories of people who attended. It's been very, very well received. But we're really moving on towards questions. And I'm happy to chat with you all afterwards if need be. And probably Cheryl has a few questions from the chat boxes.
So thank you very, very much, Dr. Rutledge. What an inspiring and mindful 45 minutes here, 50 minutes that we've taken. I found it to be very good for my own health, learning the techniques that you shared with us. Absolutely. And your talk it brought so many things into focus for me, as I was a care partner for my late husband who had an MPN blood cancer. So it brought a lot of things back, grounding them for me. So certainly thank you very much for your talk today. We did have one question that I would like to ask. Is it okay if you are able to share this, the form on your slide, so that people can utilize this, the form that you presented in your slide? Can you share that with us so that we could share it with our patient community so they can utilize that in their own personal circumstances?
Is that one right there after?
Or? Going back a few. So the columns, the one with the columns.
Oh, right. Yeah.
Yes, that one. So those ones, perhaps that might be.
Well, this will be available through YouTube, right? Be able to share that afterwards.
Absolutely. So we will have our video posted on our website and our YouTube channel. So definitely they'll be able to utilize the learnings from your slideshow for sure. We have another question here, and let me just go to our chat. You mentioned Qigong. Are there other practices you would recommend?
Yeah, so we talked about this idea of practicing a relaxation technique, right? So it's the idea of allowing the body to relax. I'll just maybe give you a little bit of background in terms of my own meditation experience. So I've been meditating for 20 years. And as I was saying, I practice mindfulness. I practice mindfulness of the breath. And I sit on some pillows, and within about 3 seconds of starting to practice, my mind starts to chattering. I start thinking about what I need to do that day. And at some point in time, I recognize that I'm thinking, and then I kind of bring my attention back to breathing. Without 3 seconds of that one, starting to think about what happened yesterday and the embarrassing things I said and did and all that stuff. And at some point in time, it's like, oh, okay, I'm thinking about yesterday, what I could have done, should have done, bring my attention back. And this is like 20 years later, right? This chattering coming back home. So that's all meditation. It's the muscle of bringing your attention back. So the question was really around this idea of other practices. I like Qigong because I can do the same thing. So I have that kind of movement of, arms in, breathing in and breathing out, breathing in, breathing out, So not only do I kind of focus on my breath and the body movements, but the same thing's happening. I'm starting to think about, oh, what's happening, in my life, et cetera, et cetera. So any activity in which you're focusing your attention on what you're doing, like a yoga practice or a body scan or a guided visualization, any of those practices where you can focus on the activity, recognize when your chattering mind is, and bring your attention back, you will get a relaxation response out of that. Be able to let go of the kind of chattering and come back home to the sense of groundedness and so on. So I think, Qigong is a great one. I highly recommend it. It's also on our website, essentially for free, healingandcancer.org.
Great. We have another question from one of our patients. I have found that daily yoga practice has really helped me in maintaining overall wellness with an MPN. Is this something you would recommend?
Oh my goodness. Yeah. So the yoga practice, I love it because it's kind of combining the physicality, right? Because you go through the exercise, depending on which yoga technique you're doing, you're practicing a relaxation technique and you're bringing your kind of consciousness within your body. And there's something about stretching the kind of core muscles that actually sends what they call the molecules of joy to your brain. So that science has evolved to say that, the muscles are actually an endocrine organ. They're sending chemicals and hormone kind of signals up to the brain itself. And it's such a beautiful activity, yoga as well. So, yeah.
Wonderful. So, folks, if there are no more questions, certainly if you do find through the rest of the afternoon that you have a question for Dr. Rob, please put it in the chat or send us an email. We'd love to get those questions to Dr. Rob, and we will get back to you individually. And we'll also post a synopsis of all the question and answers on our website for those who weren't able to attend, but also perhaps if you weren't able to jot down some notes or hear the question and answer during our session today, we'll have that there for you, as well as our recording will be on the YouTube channel, our YouTube channel for the session for today. So at this time, I would like to thank Dr. Rob Rutledge for coming and speaking to our community. What a great talk you gave. It brings to light how much better we can have a better quality of life with the diagnosis that we have and that we're consistently and constantly living in. And I think that this is not only good practice for our patients, but also for those of us who are caregivers or care partners. It brings back the centeredness of the overwhelming feelings that care partners can have as well in a diagnosis of their loved one, and living continually with that diagnosis and that disease.
Yeah. Thank you. Thanks, everybody. Have a great afternoon.
Great. Morning. Thank you again. It was wonderful. As I teach online, this is how we clap. Great. Thank you so much. All right. So, folks, we'll be taking a quick intermission, a stretch and refresh. We'll reconvene at 2:05 promptly. So please have a bio break, get yourself a tea, coffee, or a light snack or something to refresh yourself. And we'll reconvene at 2:05, where we'll announce our Canadian MPN Champion Award winners. And we'll have a quick presentation from our Advocacy Committee from the Canadian MPN Network. And we'll be right on time with our acknowledgement and thanks at 2:50 this afternoon. So we'll reconvene in just 5 short minutes. Thank you. So thank you very much for having a quick bio break, a stretch and refresh break with us. We'll now get on to the next activity within our afternoon conference, and that is announcing our Canadian MPN Champion Award winners. Today, it's my honor and privilege to introduce our newest Canadian MPN Champion Award winners. They are, in the physician category, Dr. Michelle Gettys from Calgary, Alberta. Dr. Gettys is smart, skilled, and compassionate. Her experience and respect level in the medical community is second to none. Doctors throughout Canada call upon her expertise and knowledge, and she is truly skilled and a blessing to the Tom Baker Cancer Centre. Always educating others as well as herself, she's hardworking and always prepared. Dr. Gettys is constantly learning and up to date with the latest advancements in not only in all hematological malignancies, especially in MPN blood cancers. Her commitment, loyalty, and care for her patients is legendary at the Tom Baker Cancer Center. No patient of hers will ever be left behind, and no patient that she sees will ever not get the absolute best treatments available from Dr. Michelle Gettys. So Dr. Michelle Gettys is our first award winner today of our Canadian MPN Champion Award. Dr. Sonia Sarkozy from Calgary is a true testament to patient centricity. Dr. Sarkozy treats patients in Calgary at the Tom Baker Cancer Center and Foothills General Hospital. Dr. Sarkozy is very well respected as an MPN hematologist and sought after for her knowledge and expertise in the treatment of MPN blood cancers. She is extremely well respected by her peers and industry partners, as well as within the research community. And finally, in our physician category, Dr. Christopher Hillis. Dr. Hillis, a hematologist at Hamilton Health Sciences and assistant professor in the Department of Oncology at McMaster University, is extremely well respected MPN hematologist who never leaves a stone unturned when treating his patients. He's extremely well respected in the MPN community, in the Canadian and global MPN community, and a researcher who is invested in making MPN patient lives better. He is often heard saying, "Don't forget about ET when research projects are proposed." His patients are extremely grateful for his knowledge and expertise in MPNs, and not only treating the disease, but ensuring his patients are living the best lives they can with this blood cancer. And finally, in our patient category, certainly last but not least, Doug Chisholm. Doug joined the Canadian MPN network a couple of years ago because he wanted to make a difference for patients who have the same diagnosis that he has. As a patient, he knows all too well the journey that living with disease can not only have on a patient, but also on the care partner. Doug has taken on the role of the Calgary support group leader and has done a superb job in leading this support group and engaging patients from Southern Alberta, Saskatchewan, and Manitoba, and assisting the Northern Alberta support group become active again. And he's a vital contributor to the board of directors of the Canadian MPN network. So hats off and a big warm congratulations to each of our award winners. So thank you very much. We're honored that each of our doctors and Doug are a part of our network. Thank you so much. And it is truly our honor to award you the Canadian MPN Champion Award for 2020-21. So everyone, let's give them a great big round of applause. Wonderful. And we will be sending our award winners a beautiful crystal award that is engraved with our logo and their name on it. And they will be receiving that hopefully within this week, coming up with a letter signed by our board chair, Joanne McKinley. So thank you once again to our award winners for all that they contribute to the Canadian MPN community and their tireless efforts in going well above and beyond in all that they do. All right, so now we'll have a quick presentation for our advocacy committee, and I'll just get our PowerPoint up for that. All right. So within the Canadian MPN network, we have various committees that will be able to support the network and all that it does. So here we have a brief presentation that will outline the role of our Patient Advocacy Committee and what they're up to in their efforts to help you, the patients, with your journey with an MPN blood cancer. So the MPN advocacy objective on a national level to actively solicit and advocate to Canadian regulatory government bodies, as well as private medical and insurance companies for the approval and implementation of new and off-label drugs and procedures for the betterment and well-being of our MPN community. The Advocacy Committee consists of 7 members: Joanne McKinley, John Clark, Marie Grenier Davis, Jean Reed, Charlie Kent, Patty Saluk, and John Eastley. Advocating for access to off-label drugs is one of the many opportunities that the Advocacy Committee will be active upon, and that's supporting MPN patients' doctors to apply for off-label drugs through exceptional and compassionate access programs, through private insurers, provincial health authorities, MPPs or MLAs in your local province. Letters of support in local Canadian MPN network groups and national Canadian MPN network groups. So offering that level of support to each patient that requires some assistance or just a little bit of advocating on their behalf. So off-label drugs, the drugs that are covered by your provincial health body, but not for your MPN. A good example is Pegasus or pegylated interferon. We know that that's an off-label drug. It's called off-label because it wasn't originally manufactured to treat an MPN blood cancer, but through discovery of clinical trials and other modalities, it is found to be an effective drug and treatment for MPN blood cancers. So currently, there's an opportunity for the Advocacy Committee to help a patient fill out the necessary forms, work with your doctor in getting those forms filled out, and advocating for you to receive that treatment to be a covered treatment by your provincial healthcare system. So, other kinds of advocacy. Well, in the future, the committee will be looking at helping advocate for federal approval of new drugs, provincial funding of new drugs, and drug trials. So certainly they have a great opportunity to be part of the advocacy campaign in trying to get new treatment options available to MPN blood cancer patients. We know that there is at least 4 or 5 new treatments in the pipeline that are very near to becoming approved drugs within our framework, within our healthcare framework. But certainly the Advocacy Committee will be there to assist you and assist the MPN community in advocating to get those new drugs approved so that you, the patient, will have access to them. So they'll be introducing themselves to the Canadian MPN hematologists by way of a letter to the hematologist introducing the Advocacy Committee and offering their help where they can. So certainly you as a patient can reach out to the Canadian MPN network asking the Advocacy Committee to help you navigate access to your treatment option if it happens to be an off-label treatment option or an opportunity where you're finding that your treatment option isn't accessible to you. So what can you do? Well, let us know if you would like us to assist you as through one of our support group members to advocate for you. Certainly to join the committee, the Advocacy Committee, if you would like. And certainly we would love to have your perspective in what you feel the Advocacy Committee could be doing. So at this point, I see that I'm just going to stop sharing, and I'm going to just let you know that Dr. Michelle Gettys has just joined us. So we welcome Dr. Gettys. I hope that I can see your picture. There you are. No, I can't see your face, but I just wanted to let you know that we've already made the announcement of our Canadian MPN Champion Award winners, and that you are one of our recipients. So we're very honored that you could take a few minutes out of your day today, and perhaps you're in clinic or you're with your family. So we do thank you for all that you have contributed to the MPN community and all that you keep contributing with to the MPN community. It is our honor and pleasure to have awarded you the Canadian MPN Champions Award. And if you'd like to, at this point in time, just say a few words. We would love to hear from you for a moment or two. I'll just ask you to unmute yourself, Dr. Gettys. Okay, let me just see.
Okay, hi, can you hear
There we
me?
go. Absolutely.
Oh, thank you. You know what, it's really a big honor, but you know, I think what's most amazing is the work of the people that are in this group and the amount of work that you and Doug and the rest of the people in Alberta and across Canada have done. It's amazing what's happened with this group over the last few years, and what we do is such a small part of it. So thank you so much.
Thank you. We're absolutely honored that you continue to support our Calgary support group, our Southern Alberta support group, and all that you do for each and every patient. Really, it's a disease. When people end up coming to you, I want to say we feel lost. Because it is a rare blood cancer, people come feeling very alone and very and have a lot of trepidation in what's in front of them. And I can tell you that your patients are in awe of what you contribute to their quality of life and the betterment of their quality of life, and making them feel secure that they will have a wonderful life living with an MPN blood cancer. So it is our honor actually to give you this honor on behalf of our organization.
Oh, thank you. Let's keep doing what you're doing. You guys do
And
a lot of things we can't do. So.
All right. Thank you so much for taking time to join us. All right. So we'll just slip back to our presentation from the Advocacy Committee. So again, if there's an issue that you would like assistance on, please let us know. Please communicate with us, and the Advocacy Committee would love to be able to help you out. And if you'd like to participate in joining the Advocacy Committee, we would really encourage that as well. So here is helping MPN patients in need, a little bit about the Advocacy Committee and what they're doing. So please, here is the email, advocacy@canadianmpnnetwork.ca. If you have a question or you need some support, please reach out to them and we'd be happy to help you. All right, so that is our presentation for the Advocacy Committee. We're a bit ahead of schedule. So at this point, I would like to go back to our agenda. And at this point, I would also just like to say who the past award champions were for the Canadian MPN champions: Dr. Vikas Gupta, John Clark, Dr. Elena Liu, and Dr. Brian Lieber. Tony Comper and Ed Pascal are award winners in our philanthropist area, and Karen Arner and Joanne McKinley. So we congratulate our 3 award winners in joining our already established champions in the Wall of Honor and our Wall of Champions, and look forward to next year. So if there's someone that you feel has contributed overwhelmingly or gone above and beyond, please watch our Facebook page, our website, for the nominations, and we'd love to have nominations next year from you about an MPN champion in Canada who goes above and beyond, or just beyond, what would be expected of someone in helping someone live better with an MPN blood cancer. So those are our past award winners. So at this time, I'd like to start into our wrap up. We are a bit ahead of schedule, but certainly I would like to thank our sponsors, Novartis, for their continued and ongoing support of the Canadian MPN network and all that we do. I'd like to thank the conference committee. No event can take place without the efforts of the conference committee. So thank you to the committee for all your hard work in planning today's event. I would like to announce that there is a survey that you'll be asked to fill out. We would love for you to give us your feedback on what you thought of today's event, and give us opportunity to share new and innovative ideas with you at our next event. So please do share your survey with us and give us your feedback. We would really enjoy reading your feedback and take that to our future events that we will be putting on. Southern Alberta support group meeting will be happening in the near future. Please refer to our website at www.canadianmpnnetwork.ca for that information, as well as the MPN Ontario meeting will be happening as well. And this meeting, I believe, is the famous Dr. Lieber question and answer meeting. So certainly if you do have questions that you would like Dr. Lieber to answer for you, you can submit them to MPN Ontario Support Group, and you can find that address, that email address on our website, and tune into that webinar, and Dr. Lieber will be happy to answer all the patient questions that are presented to him. Leukemia and Lymphoma Society of Canada will be having an MPN webinar on Wednesday, February 10th at 4 p.m. Eastern Standard Time. So please go to the LLSC website and register. It will be done by Dr. Linda Foltz from Vancouver General, and we are co-sponsoring that webinar with Leukemia and Lymphoma Society of Canada. If you'd like to help out and volunteer, please contact the Canadian MPN Network. We're always looking for committee people to help us with our efforts and help the support groups in all that they do. So please, if you'd like to volunteer, we can always use another set of hands in any way, shape, or form. Even if you don't have a whole lot of time, but would just like to do something small, we would be glad to take your time that you do have, that you could commit to us and that you're able to commit to us. So with that, we are a bit ahead of schedule. I'll ask Joanne McKinley, our chairperson, if she has any closing comments. Oh, you have to unmute yourself, Joanne.
There we go.
Perfect.
I would just like to thank everybody for attending, and we'll look forward to seeing you in September when we will have our next MPN conference. I think it's going to be virtually, but yeah, we'll be seeing you then. So thank you for attending, and we'll be looking forward to seeing you.
Absolutely. And some further information, we will be starting to have quarterly webinars for our patient community in Canada. So please watch our website, watch our Facebook page for updates on any of our upcoming webinars that we'll be having for our patient community. So thank you once again for attending today's session. We really wish you a wonderful day, and be safe and be COVID-free wherever you are. Please stay safe and keep your bubble safe as well.